Thank you for joining. My name is Jane Parmley, and I am a faculty member in the Department of Population Medicine. I am also the Graduate Program Coordinator for the combined DVM-MPH program here at the University of Guelph. This is a quick outline of what I hope to cover over the next few minutes. I'd like to quickly introduce the DVM-MPH program and why it might be of interest to you, and provide some information about how to apply. So, why should you consider the DVM-MPH program? First and foremost, this combined program will provide vet graduates with both formal and additional training in public health. The additional training will support graduates working in more traditional clinical settings, as well as those interested in exploring alternative careers in public or animal health. To date at Guelph, 16 DVM graduates have completed their MPH program, often after being in practice for several years. Those graduates are now working in practice with federal government agencies, including the Public Health Agency of Canada and the International Development Research Centre, or IDRC, with provincial and territorial governments at local public health units, with non-governmental organizations such as the Wildlife Conservation Society, in academia, and in industry. How does the combined DVM-MPH program work? Basically, it pairs the existing DVM and MPH programs together and enables students to complete both degrees in a reduced number of total semesters. There are no changes to the DVM curriculum. Students enrolled in the combined DVM-MPH program will complete the 4-year DVM program as usual. They will then go on and complete the required courses for the MPH program in 1 year afterwards. Students who are accepted into the DVM-MPH combined degree program will be exempted from the 2 credits of elective courses usually required of MPH students. Some of the public health competencies are felt to be addressed through the DVM program, particularly in health management courses, art of veterinary medicine courses, as well as clinical medicine courses and the principles of disease course. Additional leadership, communication, and collaboration skills and knowledge are also learned and practiced in the veterinary externship required between 3rd and 4th year, and in rotations taken during phase 4. The purpose of the elective MPH courses really is to provide more in-depth study of public health, and we are confident that the learning outcomes and competencies gained through the DVM program offer this depth of study in veterinary public health. To meet the requirements of this new combined program, DVM students will be required to complete a new One Health module that is being offered as part of the Health Management 3, a required course in Phase 3 of the DVM program. Currently, this module is offered in January of each academic year. If you enroll in this combined program, you will receive 2 separate degrees. A DVM degree will be issued when you complete the DVM program, and an MPH degree when you have completed those program requirements. This table shows the course load for the 2 options of completing the MPH program itself, as well as the course load for the DVM MPH program. The combined DVM MPH students will complete the required MPH capstone course, 0 credit rating, during their first MPH semester, rather than after their public health practicum. In the capstone course, DVM MPH students will reflect and present on how their DVM training aligns with and complements the field of public health, perhaps a One Health project that they were involved with, or on their experience during a public health related externship during their DVM training. The practicum itself will then be in your 3rd MPH semester, and we will work with you to secure relevant veterinary public health practicum placements that will really maximize use of your DVM skills, as well as providing opportunity to build your public health knowledge, network, and skills. As I mentioned, the practicum ideally will take place after you have completed the required MPH courses, as it really is intended as an opportunity to practice and refine your new public health skills. However, if you are able to secure a practicum placement earlier, for example in the summer after completing the DVM program, we may consider an exception to the order of the program requirements, and this will be decided on a case-by-case basis. Here are the 9 required MPH courses, their course codes and titles. And you can see the topic areas cover a breadth of disciplines, including epidemiology, health administration and promotion, infectious disease, environmental public health, and communications. And this slide shows your course schedule for the fall and winter semesters of the MPH component of the program. The fall semester has a particularly heavy course load, and in addition to the courses shown in the table, PopMed 6200 or Epidemiology 1 will need to be taken as a distance education course to avoid scheduling conflicts. Epi 1 is the only course in the MPH program that is offered as a DE option, and it is only offered in the fall semester. The winter semester is much less heavy in terms of courses and presents opportunities to take additional courses that you may be interested in, or to consider working part-time to secure and get more experience in veterinary practice. I am pleased to confirm that we have funds to support up to 5 DVMMPH students per year with a stipend each of $25,000. The stipend will be paid bi-weekly, and pay will be distributed equally across the 3 semesters in the MPH part of the program. To be eligible for the combined DVMMPH program, you do need to meet the admission requirements of both individual programs. If you are a current DVM student, you've clearly already met the requirements for the DVM program. You are able to apply to the combined program in either your 3rd or 4th year of the DVM program. If you meet the program requirements, you will be conditionally admitted to the combined DVMMPH program. So if you apply this winter and applications are due February 1st, you will be admitted for fall 2022 if you are in 4th year, or you will defer your acceptance and start of the MPH program to the fall of 2023 if you are currently a Phase 3 student. Your acceptance is conditional upon you completing the DVM program. Information on how to apply to the DVMMPH program is available on the MPH website at the link pasted here. As I mentioned earlier, applications are due February 1st and must include 2 letters of reference. Both academic and professional references are acceptable, but one should speak to your potential as a graduate student. Any academic reference should be able to comment on this ability. When you apply, please make sure you select the DVM-MPH option and not the regular MPH option. As DVM students, your applications will be reviewed separately from the other MPH applicants, and at this time we plan to accept up to 5 DVM-MPH students into the program per year. Your applications will be reviewed by myself, another One Health faculty member, and the coordinator of the MPH program at the University of Guelph. More information about the DVM-MPH program is available on the MPH website, on the One Health Institute website, or you can reach out to me directly and I will do my very best to answer your questions. Thank you for joining and good luck in all your academic adventures.